For the teen who is suffering from social issues, I definitely think that if it's because of deformity or an issue that the parents feel like can be corrected by the teen having plastic surgery, I think that it can be a positive effect. For the teen who has had weight issues, or for the teen who is doing it for a positive outlook or a positive reason, then absolutely. But I think that if she's doing it to become the it girl or to become the girl that everybody desires, then I think that it's a negative effect. But I also think that it could be a little bit of both. Some teens will do it thinking that it's going to improve their social status, and it doesn't. And then some teens will do it and it does help them out socially. So it just depends on the standpoint that the teen and the parents have decided is the best outlook for the student.
If you have like reconstructive surgery, or like if you have something wrong with you, like some kids have different disorders or diseases, or they're born with some sort of physical issue, then if they have plastic surgery, it'll probably make them feel better psychologically about it. On the other hand, though, if they have plastic surgery for cosmetic reasons, you just don't like your nose, or you want to have like Botox and all that stuff, it probably is indicative of something wrong with the culture. And a kid that wants to get plastic surgery for those reasons probably already has psychological issues. Like they may have low self-esteem, insecurities, things like that that are driving them to feel like they need to change their appearance. And a lot of people who have gone on to get those type of surgeries, when they become an adult, most of them regret it. And then there are other health complications that could come from it. So I think it probably will affect them negatively in a psychological way.
Plastic surgery has a psychological effect on teens because it makes them feel like they have to fit in and conform with what everyone else wants instead of being themselves.
Expanded my pathways and took away my adenoids. After the surgery, well, at first it was very bloody. It took a very long time to heal, but afterwards I realized that I could breathe. Ever since I was little, I was diagnosed with bronchitis and I had problems breathing. And until that moment, I realized that I wasn't breathing well when I was little. It was very difficult for me to breathe, and realizing that I could breathe made me very, very happy and very, very thankful that I had this surgery.
If you are a patient that, I don't know, you request something that cannot be done, then your expectations are beyond the capacity of the surgery. You're going to be disappointed, even if I do the surgery. Even if I do the surgery because I think I can do it, if what you're requesting cannot be done or cannot be achieved, you shouldn't do the surgery then, because it may have negative sequela. However, there are some patients that, you do the surgery and you talk to the patient and you think you know what the expectations are. The question is still disappointed. The disappointment based on fact. I mean, did the patient's surgery not meet the expectations of the surgeon, and therefore it doesn't meet the expectations of the patient? And in that case, sometimes we can address it surgically by reoperating. But definitely, it always has a negative impact if the patient is dissatisfied with the surgery. However, there are some that feel more benefit than others, and so it depends on the patient. Well, remember, there are two types of plastic surgery. There's plastic surgery for cosmetic reasons, and there's plastic surgery for reconstructive surgery. So, you are the typical plastic surgeon surgery patient that requires surgery for reconstructive purposes. You had a condition, and it is an area of plastic surgery we treat. So, in that sense, absolutely. If you're a teen that have some sort of medical problem that requires any plastic surgery treatment, yeah, definitely. If you're talking about cosmetic surgery, there are several instances that we do perform plastic surgery on teens. One of them would be there is something called virginal hypertrophy of the breasts, which means that your breasts grow out of proportion with your body and they become so huge that they give you symptoms such as back pain back problems, and for that reason we make them smaller, with the knowledge that sometimes your growth has not finished and that you may need additional surgery. But if the breasts are too big and they're giving you medical problems, we might go ahead and do surgery while you're in your teenage years to improve those symptoms. There are other younger people or teens may be necessary in some cases for specific medical reasons, or it may be good to improve the patient's self-esteem.
To get plastic surgery if they have a deformity that constantly distracts from their daily lives. And
Plastic surgery would be needed for a teen if anything happens to them medically. Not because of so much low self-esteem. Like if anyone has a burn, a third-degree burn, yeah, it's understandable. But just to enhance a part of their body, I feel like it's going against their confidence.
If a teen has plastic surgery, I think it should be first and foremost for medical reasons. If you have a medical condition where you have some deformities that you want to have corrected, I definitely say go for it, because children can be cruel, and that goes back to bullying and not feeling comfortable. But I don't think that they should do it for general beauty purposes. I think that a lot of times, again, society has convinced them that we need to look a certain way, and it's not necessary. I also think that if they've had car accidents or medically, if you need it medically, definitely I say go for it. Breast reductions I think are awesome for children, for teens who are uncomfortable, and deformalities, of course. But other than that, I think that if you are not doing it for medical reasons, then you should avoid the knife.
Person or teen should get plastic surgery for medical needs. Like for me, I had trouble breathing, so I needed the surgery to be able to breathe. But I feel like that's the only reason that one should have plastic surgery.
Well, I think when you evaluate a patient, you have to ask them why they have the surgery. And if that surgery is being done, I mean, if you're trying to get surgery because you like a boy in school and he doesn't look at you, then that's not a good motive to have surgery done. Because I can't guarantee that I'll do the surgery and the other kid will look at you. Yeah. So, that's a motive that you would ring bells not do surgery on a patient whose motive is to try to attract the attention of another person. So, usually motives that justify surgery are conditions or deformities or appearances that can be modified by surgery, and that do cause the patient some concerns or social issues. I think you have to talk and individualize with the patient to determine whether surgery is going to be really beneficial psychologically or physically, and choose patients well.
I need only 16, so she's probably not that grown. So what
that's what I'm saying. She might mess up the growth.
Well,
If she's 16, get a breast reduction. What happens? It's
when
gonna
she
get
keeps growing. The thing with being so young and getting a surgery like that is you don't stop. Well, with your face, you don't stop growing to about 17, 18. With your body, you can continue to grow because that's that now. So if she grows again, then she has to get another one.
That's what I'm saying. She should just wait.
But it's different with everybody.
Yeah.
She should just wait.
It's different with everybody.
But I'm saying if she get it way smaller and she grows more, wouldn't be as big as what they are, so it really wouldn't matter.
So it will be a positive outcome. Cosmetics, that's anything like let's say you want a bigger butt, so you get butt shots. There's no like medical reason behind it. But with reconstructive, that's like, let's say you get in an accident and your arm's burnt up, so you need a skin graft, something like that. So, let me ask you questions while we're talking about. What's the two difference between the two types of plastic surgery?
Reconstructive is like mixing, and then cosmetic is like if you want butt shots, because your butt's not big.
Right. For case number one, her name is Terry. She's 14. She was born healthy, no health issues. She wants a rhinoplasty, which is a nose job. Her reason is because she doesn't like her nose and her tush doesn't like her. So if she has plastic surgery, do you feel it will be positive or negative outcome?
Negative.
Why?
Because you still not gonna like her.
It's not anything wrong with her, it's just the boy.
Is she doing it for her boob?
She's 4.
They come and go.
Alright, for case number two, his name is Michael. He's 17. He was born with a facial deformity. He wants a optogonectic, which is basically an underbite surgery. His reason is to fix his bite and the way he chews. If he has a surgery, you think it'll be positive or negative? Positive. And why?
Because he actually has like a actual problem, not problem, but a serious medical health issue.